Good morning, everyone.
Good morning.
Good morning. On behalf of the Navicent Health Board of Directors, thank you for joining us as we celebrate the completion of the construction for the temporary medical unit. We are continuing to practice social distancing and universal masking as we continue to keep our community COVID safe. Navicent Health is beginning to see a return to pre-COVID business volumes as patients return their standard appointments and procedures. And we are thankful that we are returning to normal. And we continue to take extra measures to ensure our facilities and our community remain COVID safe. These measures include limited visitation, universal masking, and social distancing. So thank you for putting on your masks this morning. Thank you for standing 6 feet apart. We have designated marks that show you where to stand. And we appreciate, truly appreciate, all your support for these COVID safe initiatives. So at this time, I'd like to invite Dr. Navicent Saunders, our President and CEO, to begin our celebration. Dr. Saunders.
Thank you, Star. That's Star Perdue, the chairman of our board. Folks, we just completed the tour of the temporary medical unit to the Governor Kemp, and it is just beautiful and highly functional. It is amazing what can be created with simple materials in order to meet the challenges of COVID-19 in efficiency and innovation. I will tell you, I was telling the Governor during the tour how grateful we are as a community and as an organization and as a community of patients for this temporary medical unit, which we call TMU. But all along, since the inception of this incredible crisis, we've gotten so much support from the governor. And we as a community and a community of patients are so grateful for all the assistance that we've gotten from the governor's office. The construction of this unit that you see in my left was truly a team effort. We would like to thank the number of organizations for the role they have played in bringing the TMU to Macon, Kemp, and Navicent Health. The B. Marcus Structures, the Salas O'Brien Engineers, Jackson Healthcare Staffing, that unit, DS Engineering, Choate Construction, Georgia Emergency Medical Management and Agency, who selected Macon as a location, and for that we're grateful. Macon-Bibb County Emergency Management Agency, and many partners that I may have not mentioned who made sure that that is possible. That was up and running and ready to go in a couple of weeks. Just over a month ago, Georgia Emergency Management Agency requested that this unit be placed in Macon-Bibb County, and of course, Navicent answered the call and said absolutely yes. As a regional tertiary teaching hospital, the medical center of Navicent Health must stand ready to take all patients regardless of their ability to pay from over 55 counties in Central and South Georgia. To place this unit in Macon-Bibb County was a strategic move by the state and appointed by the governor to centrally locate additional resources. As you know, COVID-19 has presented us with a lot of unknowns. In April, when the decision was made to place this unit here, we anticipated a peak in the number of COVID-19 patients who would require care. Although this TMU was not necessary for patient care at that time, this precautionary measure was taken in the event that extra capacity was needed. Thankfully, we have not needed the TMU to date and have had ample capacity to care for patients in our hospital. But we're so glad and so grateful that we have the state's full support, particularly Governor Kemp, as we seek to provide high-quality care for all Georgians through this pandemic. Currently, we're seeing fewer and fewer patients test positive for COVID-19 or patients who require care in our hospitals. We are beginning to return to normal business, the pre-COVID times, but we're also taking precautions to keep our facilities and our community COVID safe. We want the community out there to know, do not delay your care. Come for help. We are here and ready to take care working. We remain vigilant and will continue to be, and always be mindful of what may happen and prepared to respond as needed. And we celebrate the completion of this unit as we stand ready to respond to whatever our state may need. We thank both our state, particularly our governor, and our local governments for their support. We have our representatives and senators here today, and I particularly want to thank Macon Mayor Robin Wicker, who will stand by us side by side during this time of readiness from the time that we had our first diagnoses. With that, I'd like to ask Mayor Wicker to please join me and share a few words.
I'm delighted to be here to say a word of thanks to the governor and his team and to Navicent for all that they have done to help set up this temporary medical facility. Now, this is a much needed precautionary measure here because of our location in the state and how we serve as a hub for medical services. It is my hope that the hospitals never have to use that facility and that our efforts locally and across the region to flatten the curve have helped our healthcare providers respond effectively to the spread of COVID-19. That said, our state's 83rd governor is a man who subscribes to the philosophy espoused by Thomas Carlyle, sit vos non vobis, interpreted as thus we labor, but not for ourselves. We can all agree that balancing the health care concerns of our citizens with the amount of economic distress inflicted upon them is not an easy balance to strike. But our governor has worked hard to find that balance, and his work is not for himself, but for the people he seeks to serve. I am proud that he has come to me and that I can introduce to you our governor, Brian Kemp.
Thank you very much, Mayor, for that. I appreciate the opportunity to be here. I first of all want to thank the local government for their support, and we've had a great working relationship over the years with Dr. Jones and your team here at Navicent. Just incredible what you're doing. I tell people all the time, the folks standing behind me, and a lot of people that you never see when you walk through a hospital or a medical facility that are in some lab or some office somewhere or some patient. They are the true heroes in today's world. I don't think there's any doubt about that. I know the people in our great state believe that. I believe it. And the people across our country believe it. So thank you all for everything that you have been doing. I also hear the support that they have given myself and our office during this unprecedented event in our state. By letting us have the extreme powers of the public health emergency for the reason that things like this could happen. The funding that we did in the amended budget is the reason that things like this could happen. The measures that we've taken to protect our healthcare workforce, to have the ability to license people from out of state, to enter into contracts with private providers that can help staffing hospitals and nursing homes all over our state. Those are things like the public health department. Thank you all for that. These temporary medical pod units, I've seen all of them now. They're really impressive facilities. The state owns them, so we don't just have them for today or what may happen, in the fall or in the winter. We're going to have them for a long time. That is a great investment for our state. If you think back to last year's SEC championship game in Atlanta, when we had a huge pipe bust at Grady Memorial Hospital in Atlanta, knocked out 2 or 3 floors. In the future, if we have an event like that, whether it's here or any other hospital around the state, literally in a matter of days, we can have that one of these facilities stood up on the grounds of that hospital to help with their bed capacity. If we have, during the time that we're in now, or a major storm event like we experienced during Hurricane Michael, or have a tornado that hits, God forbid, one of our hospitals, we now have a resource where we can quickly deploy. So I think these assets are not only good for today, but they're going to be good for the future. And I know Dr. Saunders and the mayor both talked about that this is a preventative measure. I can assure you, when I made the decision to purchase these mobile hospital units, it wasn't as a precaution. I mean, the models that we were seeing were really scary to look at from a hospital bed capacity. So we did that in a move out of necessity. Thankfully, it's now turned in to being a safety net. And that is because our citizens have done exactly what we asked them to do. They have helped us flatten the curve. They have helped us stop the spread. They have given us time to build up our hospital bed capacity, whether it's mobile units like this, finishing the towers that Piedmont has in Atlanta, standing up the Phoebe North facility in Albany, and other things that we have worked on to be prepared for that peak. Well, depending on what model you look at, and some models twice now, we have passed our peak. Our numbers continue to look really good in Georgia, which is why we made the decision a little over a month ago to reopen our economy. Because as Dr. Saunders said, the effects of our economy and the effects of people not coming to get health screenings, treatments, and surgeries that they need, we're starting to outweigh the virus itself. And as I've told a lot of people over the last several weeks, we are fighting two battles now. We continue to fight COVID-19. We got to continue to socially distance ourselves. We've got to continue to be smart about large gatherings, wearing a mask when you're out in public to protect others from you potentially being asymptomatic. We've ramped up our testing and done contact tracing. So we got to continue to fight the battle against the virus, but we got to also continue to fight every day to get our economy reinvigorated. And that is happening as we speak. And I'm very thankful to all the businesses that have adhered to the guidance that we put out. And if you would take time to read that, it's lengthy, it's cumbersome, and we know that, but it's necessary right now. If we can continue to drive the numbers down and continue to get further past our peak and take care of that vulnerable population that's out there, we can continue to lift restrictions. But we're going to do that just like we moved in to the shelter in place. And that is in a methodical way, following the advice of public health officials and working with great folks that are right here on this campus, measuring our hospital bed capacity, looking at the number of COVID patients that they have. There's a lot of different data that we're following. I just wanted to mention a couple of things real quick, and we'll take some questions, but our testing continues to ramp up. I'm so appreciative of all that are helping with that, the Georgia National Guard, our public health departments all over the state, our private sector industries, and our hospitals as well. It took us 8 weeks to test 2% of our population. In the last 2 weeks, we've tested over 2% of our population. So you can see that we've greatly ramped up our testing. We continue to work with all our partners, just like we did to stand up the mobile facility, contractors, local government, the folks at GEMA, the folks here at the hospital, and many other folks. And we'll continue to do that because we're in this battle together. And we got to continue to fight together. But if there's one thing that I can tell people today on the grounds of this hospital, if you have been delaying treatment, if you need a screening, if you are not feeling good, you need to call your doctor, call your hospital. They can safely treat you. The hospitals, we've all learned so much. There's nobody better suited to deal with you and the COVID patient than this hospital right here. They know how to do that in a safe environment. You can feel confident that you can now come if you need, a knee replacement, a hip replacement, if you need cancer treatments, different screenings. If you're not feeling please do that. We do not want the virus to cause another bad health outcome that may be pre-existing with you right now. So I hope that you will adhere to that advice. Don't take my word for it. Call Dr. Saunders' team, call your doctor, let them talk through and tell you how they're dealing with these situations. I've been hearing great stories around the state. A friend of mine got a hip replacement the other day that he'd been putting off since April. He said it went great, they took good care of me, and I felt completely comfortable when I was in that environment. I want to urge people in the middle Georgia area to do that. So thank you guys for being here today. Thank you all again for the great work that you're doing. We are indebted to you all, and we'll be glad to take a few questions today.
Yeah, how are you, Governor? Thank you for your time again today. We appreciate that. I do want to ask you this. I know you talked about the numbers are looking better, trending in the right direction. Obviously, we see that we have a lot of bed space around the state with the pods, et cetera. You had also recently, I know there was some pushback by the mayor in Atlanta. I wanted to see if you had a conversation with the Trump administration or the vice president during his visit last week about this and where that stands.
Yeah, I did talk to, we had a great visit with the Vice President last week, visiting, we had a nice lunch at a dine-in restaurant, really trying to build the public confidence that our restaurateurs and a lot of our entrepreneurs and business people are really adhering to the guidance and doing the right thing to keep their patrons safe. And I think more and more Georgians are getting confident in that. I think the Vice President felt like it's important to come down and see that for himself. And we really had a great visit. We talked about that on our call with him yesterday with the rest of the nation's governors. I did not talk to him about the RNC convention because I didn't realize there was an issue at the time. Obviously, I tweeted about that yesterday. I'll kind of let that tweet speak for itself. We'd love to have the RNC here. I feel like we can do that in a safe way. It's not until August. We'd have plenty of time to prepare for that. I know there's a lot of other states who want to have that too, and I know there's been a lot of time and commitment put into having it in North Carolina, so we'll see what they do. But we have the hotel space and the event venue space in Atlanta for large events. We've done it before. We just had probably one of the greatest Super Bowl experiences ever, even though the game wasn't that great. Dolphin fans coming into Atlanta, the game day experience they had that whole week, it was phenomenal. And we can do that again, I believe, if that's something that they're interested in. Which that's the place.
And Governor, where would you do that? Would you do this at the Georgia World Congress Center?
I think there's a lot of different venues you could do that. I'm not sure where you could do it. I'm sure there'd be a lot of folks that would want to host that. Well, that's certainly what I want to do. I think that's up to the people of our state. I've been telling them that they'll continue to follow the guidance. And it's really interesting on the call with the Vice President yesterday, Dr. Fauci was talking about, this is really the first time I've heard him talk about this, but this whole second wave that they're talking about this fall or this winter, and he was making the case that we can avoid a second wave if people continue to follow the guidance. If they just continue to use common sense and be smart. And I know Georgians can do that. That's one reason that I opened up our state when I did, is because I felt like our people have learned a lot. They get it. They know what they need to do. They can deal with it. We can't keep fighting the virus from our living room. The hospitals have been fighting it every day right here. Our first responders are fighting it on the streets out there every day. And the general public's got to learn to do that as well. And I believe that they have. So, some churches have gone back to in-person service, some have not. The ones that have, people are going, they got to be really smart. If you're elderly and medically fragile, you really need to think about following that service online. If you are going to go, you definitely need to wear a mask and make sure that you're socially distancing yourself and not put yourself in harm's way. When people are going, out to eat, going out to do any other kind of activity, just be smart. Go to places that follow the guidelines, that place that are taking care of their patients and their employees. If they're not doing that, don't go to that establishment. People continue to follow that guidance and not let their guard down. I mean, the virus is still active. The latest guidance is 20 to 30% of the spread is coming from asymptomatic people that don't even know they're sick, that are going somewhere and spreading the virus. And that's why we have to continue to practice social distancing. Look, I'm not saying that we're going to be arresting people on the sidewalk if you walk within 6 feet of people. If you're passing by somebody, you can't spread out. Just use common sense. Don't cough on them. Turn your head, walk by them, and move on. I think as long as people continue to do that, it'll be great. And I think if you think back last weekend, great holiday weekend, just about every hotel room in St. Simon's was booked. But we had no issues on the beaches. Very little. Mostly a few verbal warnings, same thing on our lakes, because people were doing what they've done for weeks in a responsible way. They've been spreading out. They're not having these crazy wild parties like we saw in other places around the country. And I want to thank my fellow citizens for that. As long as we continue to operate like that, we don't have to have a second wave, and we can continue to move back to a new norm. We're not going to be back to the old normal until we get a cure vaccine.
What do you say to people? I'm sure you've seen it. We've seen it too. They're become someplace to wear masks and social distancing helps on or refusing to do so. What do you say?
Well, look, I get that. We're not an 80 state here in Georgia. We want people to be responsible and to be smart. And I'm trying to lead by example. I'm by no means perfect. I almost shook somebody's hand just a second ago. I keep trying to refrain from doing that because I know one of my friends in the media out there would make a big deal of that. But we just have to continue to use good common sense. It's a good idea to wear a mask, not to protect you, but to protect others from you if you happen to have the virus and don't know. But not everybody wants to do that. I get that. I don't think we need to start pointing fingers at people. I think we just need folks to be smart. If you're just adversely not going to wear a mask, I would encourage you to do that if you're out. If you're not going to, then I would just ask you to respectfully practice social distance, and be smart about what you're doing. And I think most people. Thank you. Thank y'all.